what we saw was that there were actually two distinct ways of deciding whether a piece of behaviour had actually crossed a boundary or not. And we refer to them as protocols in the report. So those are ways of assessing a piece of behaviour. So the first is that you compare the piece of behaviour to an external standard. You say if this piece of behaviour breaches certain standards, then it's unacceptable. And we call that the standards protocol. And the important thing there is that the standards they're independent of that particular relationship. The second approach, though, is to say, well, really, we've got to look at the relationship between these people and the norms that exist between these two people. So if this is a piece of behaviour that is within the norms of that relationship, it's okay. But if it breaches those norms, then it's a problem. It's broken the boundary. And of course, the clearest sign that it's breached those norms is if one of the people is unhappy. So you do something to me and I'm unhappy with it, then it's breached the norms. Now, the key thing about these two protocols, these two ways for assessing behaviour, is we'd see the same people using the two protocols. So there's one example, for instance, where we've got the same person talking about the same behaviour, and 2 minutes apart they're using the one approach and then the other approach. So that obviously raises a very important question, which is how do you actually decide which protocol to use on any particular occasion? Because there's these two ways that we can assess whether a boundary's been crossed. So you have these two protocols, the relationship protocol and the standards protocol. As we saw, the same people are using the same protocols to talk about the same behaviour, sometimes within a couple of minutes. So how do you decide which of these ones to apply in any particular setting? How do you decide how you should appraise this bit of behaviour? So in summary, there were two key themes that came out here. The first is that the more serious a behaviour is seen as being, and remember that goes back to things like, is it physical, is it intrusive? The more serious it's seen as being, the more likely you are to apply the standards protocol. You're more likely you are to say, this is we can't refer this just to that relationship. We have to look at the absolute standards here. And the second point is around the setting it takes place. So we can talk about two very clear sort of extremes. At the one end, you have entirely social settings, people having a drink outside of work. Well, in those settings, it's the relationship protocol. At the other end, we have obviously professional settings. So me working with a colleague with a patient, that's a very clear sort of setting where we need to apply the standards protocol. The challenge comes in what we've called in the report quasi-social settings in the workplace. So that might be in the team room, when patients aren't around, and the sort of interactions happen there where you get a blurring. And a few participants felt there shouldn't be any blurring in the workplace, but in general people talked about us being a really important space. And that's where some of the grey areas and the challenges will typically come up. And I'll just mention two things that sort of set a limit on those quasi-social spaces. One is one I've just touched on, which is that there can't be any patients there, so it has to be private. And the second thing that really can confound it is if there's a lack of parity between the people involved there. So the primary example there is seniority. If we're talking about a more senior person and a much more junior person, especially if that person has a managerial responsibility, then that's really going to suggest we should be a little bit more by the book, stick to the standards, because it's going to be very, very hard for that junior person, for example, to actually be able to withhold consent. Or indeed, it can be the other way around. If a junior person is doing these things, it can put the senior person in an awkward position.